Good morning. My name is Trevor. I'm going to be your provider today. May I ask your name and date of birth?
Reese Pitson, 10/31/1986.
Mr. Pitson, that makes you 38 years old, and the chart has you as a Caucasian male. Is that information correct?
Yes.
All right, what brings you in today?
I've been having really bad nausea and vomiting, and that started yesterday morning and kind of just abdominal discomfort everywhere.
All right, so we have some nausea, some vomiting, and abdominal discomfort that started around yesterday morning. Is that correct?
Yes.
Okay, have you had any fevers that you know of with it?
No.
No flush, none of that?
No.
Okay. So I'm going to go through these symptoms, your nausea, your vomiting, and your abdominal pain, one by one. Is that correct?
Yes.
Is that okay?
Yes.
All right. So you're vomiting. You said since yesterday morning, correct?
Yes.
So around 24 hours, would you say your vomiting is?
Yes.
Okay. The duration, how long are these spells lasting?
They're kind of sporadic. I don't really know a set time.
They're kind of sporadic throughout the day?
Yes.
All right. Has it been more of projectile or subtle?
Just normal vomiting, not projectile.
Not projectile vomiting.
No.
Okay. How would you describe the emesis?
Green.
It's greenish color?
Yeah.
Okay. What makes these spells better? Does anything help you?
Just when I sit up. That's
Just
it.
sitting up position. Okay. So what makes these spells worse?
Whenever I eat and drink anything, I can't keep anything
You
down.
can't keep any food or oral intake down.
No.
All right. So they're kind of throughout the day, worse when you eat or drink, and it's been going on for around 24 hours yesterday morning.
Yes.
Okay. How severe are these vomiting episodes in comparison to other vomiting episodes?
Way worse than before.
Way worse. So this is some new stuff you're experiencing. Okay.
Yes.
And I'm going to touch on your nausea. It's kind of accompanying your vomiting. Is that correct?
Yes.
So it started the same time, it has the same duration, and it has the same timing, correct?
Yes.
With the vomiting.
Yes.
And to clarify, it makes it worse. You're more nauseated when you eat or drink anything,
Yes.
and you're a little better when you're not eating or drinking in between spells, and then when you sit up.
Yes.
And describe the severity of your nausea.
It's also worse than I've ever
Also
had
worse than you
before.
ever had before. All right. We're going to get you something for that, okay? Your abdominal pain. How long have you had this discomfort?
The abdominal pain actually kind of started a couple days before the vomiting.
A couple days before. So vomiting and nausea, 24 hours. We'll say abdominal pain 3 days ago or so.
Yes.
Okay. And its location, is it any spot in specific or is it just everywhere?
No, it's everywhere.
No specific spot on your stomach hurts worse than another?
No.
Okay. How long does this abdominal pain usually last?
It's
As in, can you help it in any way?
other than position, no, I can't really help it. It's gotten progressively worse.
Progressively
It
worse
started-
for 3 days. Okay.
Yes.
Nothing helps it besides kind of sitting up a little bit.
Maybe mildly helping it. But
And you haven't taken anything to make it better, have you?
no, I can't keep anything
Can't
down.
keep any
so
medicine down. Okay. So 3 days abdominal discomfort generalized, right? Nothing makes it better or worse. Can you describe the severity?
it's also worse. I've never had abdominal pain like this. It's probably
Can you give me a number on a scale of 1 to 10? The 10 being the worst pain you've ever experienced, the 1 being a mosquito bite or so.
it's probably like a 7 or 8. Right
7 or
now.
8
And
generalized
It's,
abdominal pain.
it's really bad cramping right now.
Really bad cramping. Are you feeling like sharp pains or just kind of fullness?
Fullness.
Fullness,
I would say.
okay. So I'm gonna go over some past medical history with you, if that's okay, Mr. Pitson.
Yeah, that's fine.
Can you describe your past medical history for me?
I've been diagnosed with GERD, hypertension, chronic back pain, and then diverticulosis in 2020.
We have GERD, diverticulosis, chronic back pain, and hypertension. Okay, and your diagnosis of diverticulosis was in 2020, correct?
Yes.
What pain medicine or pain pills are you prescribed for that?
I believe it's Norco.
Norco? Okay. How often are you taking your Norco for your back pain?
The doctor said I could take it every 6 hours when I need it.
Every
I'm
6
pretty
hours?
consistent with that.
Do you know the dose of your Norco by chance?
I think it's 7.5.
7.5, okay.
Yes.
And are you taking anything for your GERD and hypertension?
Yes. Pepsid and hydralazine.
Take Pepsid and hydralazine. Do you know the number dose on those drugs?
Pepsid, I think, is 20, and I think hydralazine is 10.
Okay, and you take those in the morning, is that correct?
Yes.
All right. Do you take any over-the-counter medications additionally to your prescribed?
I sometimes need to take ibuprofen as well to help when I'm in
Ibuprofen.
extra pain.
All right. And how long when was the last time you've taken any of these medicines?
I haven't had anything since yesterday morning before the vomiting started.
Okay, so no Norcos, no blood pressure medicine or Pepsid since yesterday morning or ibuprofen.
No.
All right. Surgical history. I'm going to run through that real quick with you. Okay. Can you tell me about your surgical history?
I've gotten my gallbladder removed. That was in 2023. I've had my collarbone repaired when I broke it in 2016. And then I got my tonsils out when I was a kid. It was probably around 1990 or something.
All right. So gallbladder, collarbone, and tonsils. Do you have any problems with surgery or anesthesia that you can recall?
Not that I remember.
Have you had any recent hospitalizations for this area of concern?
No.
No,
No, I haven't been to the hospital in a long time.
All right. Have you followed up with a primary care physician?
I do normally follow up with the primary care provider.
And allergies. Can you tell me about your allergies?
I'm just allergic to penicillin.
Penicillin. What does that do for you?
It makes me itchy and break out in a rash.
Rash and highs. Okay.
Yes.
And that's just penicillin, correct?
Yes, just
Okay.
penicillin.
Flu and COVID vaccine. Are you up to date on those?
Yes.
Okay. Can you tell me about your family history? Just a brief family history of your mom, dad, and any siblings you may have.
My mom, I think, has hypertension and AFib, I think is what it is. And then my dad has hypertension and diabetes. And then I only have a brother, but he doesn't have any medical issues.
All right. So your mom and dad have hypertension, dad has diabetes, your mom has atrial fibrillation.
Yeah, I think that's what it's
All right.
called.
All right. And what do you do? What do you do for work, Mr. Pitson?
I'm a construction worker.
You're a construction worker. That's got to be hot during the summer. I know it is.
It is.
Education.
I just graduated high school.
High school, okay. Can you describe your living situation?
I live with my wife. We've been married for a couple years.
All right. And no confidential issues that I need to address, no safety concerns, violence issues.
No.
Are you completely independent on your ADLs despite, being in some discomfort?
Yes.
Do you travel any? Have you traveled out of the country recently?
No.
No traveling. Do you smoke?
No.
Okay. Do you drink alcohol?
Yes.
Can you describe your alcohol consumption?
I drink daily.
You drink daily? What do you drink daily?
Wine. I normally have like 2 to 3 glasses when I get home from work, especially when it's a stressful day.
Okay, 2 to 3 glasses of wine every night.
Yeah.
All right, Mr. Pitson. Can you tell me about your diet? Do you follow a diverticulosis specific diet?
No.
No dietary,
I eat well.
no dietary supplements or anything of that nature? All right. I'm going to review just some basic symptoms with you before we go to your physical exam in the other room. Is that okay?
Yeah, that's fine.
Okay. So, have you had any weight change or appetite change in the past few days?
I mean, just my appetite's changed over the last 24 hours because I can't keep anything down, but no.
Weakness or fatigue of some sort?
Yeah, since I started vomiting, I've kind of felt weak. And
Right, can't get anything down. Okay.
Yeah.
Have you had any new vision changes, headache, neck swelling, stiffness, anything of that nature?
No, but I have been get dizzy a little bit recently.
A little dizzy?
Well, since it started.
Describe that in further detail.
Like when I'm at work and stuff, my head just kind of, I don't know how to describe it. I just get dizzy and have to stop for a second.
All right. You get dizzy at work. Do you ever get dizzy at home?
No.
Okay. No vision changes, you said. No earache, no redness, no sore throat, no congestion, nothing of that nature?
None of that.
Have you had any new skin lesions or skin rash or any new hives that you've noticed?
No.
Okay. No chest pain, no heart thumping that you know of?
No, none of that.
No shortness of breath, no cough?
No.
Okay. Have you had anything wrong with your peeing? Are you on normal schedule with your urination?
I've actually been peeing a little bit less lately, and my urine has looked different. It's been darker.
Darker urine and less urine?
Yeah.
Okay. Does it hurt or burn when you have to go to the bathroom? Okay. Have you had any problems with your muscles? Are you noticing any joint stiffness or weakness?
Nothing in my chronic back pain that I always have.
Just your
though.
chronic back pain. That's unchanged, right?
Right,
And
yeah.
that's been relieved by your Norco?
Normally it is,
Okay.
yes.
Have you had any depression, seizures, tremors, memory changes, anything of that nature? Any nervousness, no paralysis, no numbness?
No.
Okay. Have you had any heat and cold intolerance or been more thirsty or more hungry than normal? Have you been sweating a lot?
I feel like I've been wanting to drink a little more, but like I said, I can't get anything down. And no, I haven't been sweating at all.
Haven't been sweating at all, even when you're at work?
No.
When's the last time you went to work?
I had to stay home yesterday morning because when all that vomiting started, I told my boss I couldn't come in. It was just too bad.
Where? So I'm going to kind of hit on these gastroenterology or stomach symptoms a little bit more, okay?
Okay.
So nausea, we covered your nausea. We covered your vomiting. It was just being green, correct?
Yeah.
Not red, not black, just green vomitus.
Yeah.
Okay. Have you had any heartburn? That's normal. That's outside the normal of your GERD.
No.
No. Okay. Have you felt constipated, or tell me about your bowel movements the past couple of days?
I haven't had bowel movement.
You haven't had any bowel movements, no diarrhea in the past. When's the last bowel movement? More than 72 hours ago, would you say?
Yeah, it was before the bowel pain started.
All right. Have you had any gas pains, any flatulence, they say?
No.
No gas pains? Your stomach feel full? You feel like you can't pass something?
Normally when my stomach feels full, I feel like I need to throw up, but yeah, it does feel like something's there.
Something's there that you can't get out. So maybe a little bit of gas pain.
Yeah, it could be. Yes.
Okay. All right. All right, Mr. Pitson, I'm going to go to my physical exam room and I'm going to do a physical exam, if that's okay with you.
That's fine.
All right, Mr. Pitson, this is the exam room. I'm going to go ahead and have you step up on the scale for me. All right, we're at 240. Can you give me a roundabout of your height?
5'10".
5'10", 240. Okay, I'm going to have you sit on this chair right here. I'm going to go ahead and take your vital signs before we begin, okay? So I got your blood pressure at 92 over 58, which is probably a little low for you. Heart rate is 118, your respiration rate is 20, your temperature is 99.1, and your oxygen is 98% on room air. So just going to begin with a general assessment. Your posture is well. You're not in any acute distress. You have good hygiene. You're not profusely sweating. However, your skin is a little tinted. That's probably just from your dehydration, okay? I'm going to ask you a silly question, but can you tell me what year it is and what's the president?
2025 Donald Trump.
All right. That covers your LOC and basic neuro exam. So can you squeeze my hands? I'm moving into the musculoskeletal part as well as still seeing if he can follow commands appropriately. So strength is 5 out of 5 on both sides. Still with the musculoskeletal, I'm going to ask you to kick this leg up. Perfect. And what about this one? Right, 5 out of 5 motor strength on lower extremities. Can you bring your foot towards you? And then step on the gas pedal. Bring your left foot towards you. And then step on the gas pedal. Okay, flexion is and extension is within normal limits on the lower extremities. While I'm down here, I'm going to feel for dorsalis pedis pulses bilaterally. So moving into the cardiovascular exam. And they are +2 bilaterally. And there's no edema, no dependent edema or pitting on the lower extremities. And the cap refill is less than 3 seconds on bilateral lower extremities. And there is no lesions or ulcers noted. Skin is within normal limits on the lower extremities. I'm now going to go ahead and check for your radial pulses. Which are +2 bilaterally. Now do not notice any edema. Your cap refill, less than 2 to 3 seconds bilaterally. And like I said, your skin is a little tinting. That's probably from your dehydration. Okay. So now I'm just gonna listen to you with your stethoscope. I'm going to listen to your heart and lungs, and then we'll move on to our abdominal assessment, okay?
Yeah.
Well, before I do my stethoscope, I'm going to look into your eyes real quick. I'm going to look in your ears. I'm going to look around this side. Okay. So the pupils are equal, round, and wrapped to light. There's no obvious abnormalities in the ears, the eyes, the nose, or the neck. There's no neck swelling. Can you open your mouth? Okay, mucosal is pink and moist. The teeth are intact. Okay. And you haven't had any trouble breathing, you said, correct?
No.
Okay. So I'm going to listen to you. I'm going to start by listening to your neck, okay? And on your neck, there's no obvious jugular vein distension as well. With the bell of my stethoscope, carotid brewery is not noted. I'm going to listen to your heart now, okay? I'm going to lift your shirt up. The apex is at the fifth intercostal space, medicular line. And we're going to move on to the tricuspid and the herbs, aortic, and pulmonic. So the heart sounds are within normal limits. They're regular. The S2 and S1 were heard. No S3 was heard. No murmur was heard. On inspection of the cardiovascular system, the chest was in normal limits. No excavatum or carnatum was noted. And I'm going to move on to the respiratory system. Just going to listen to your lungs. Okay, give me some deep breaths. All right, Mr. Pitton, I'm going to raise your arm. I'm going to listen to your lateral lungs. 3 spots. Okay, I'm on this side. Okay, I'm going to listen to your posterior. All right, Mr. Pitts, I'm going to ask you to lay on your back and lift your shirt if you don't mind. I'm going to start my focused abdomen assessment. All right. So, just on inspection, I can obviously notice that there's no apparent abnormalities. There's no obvious hernia or indulging of the liver or the spleen. First, I'm going to begin auscultating the abdomen. I'm going to start in the right lower quadrant, and I'm going to go in a clockwise manner. So the bowel sounds are hypoactive, and there is some obvious abdominal distension. And we do notice some surgical scars from the cholecystectomy laparoscopically. I'm going to feel on your abdomen, okay? You tell me when it hurts. Is it just some generalized pain?
Yeah.
Okay. There's no obvious enlargement. Obvious enlargement. I'm going to press down on you. Tell me if it hurts when I pull my hand back.
No.
Does it hurt?
Uh-uh.
All right, Mr. Pitson, I think that completes our focus exam. We're going to take you to the back and start running some tests and get some lab work from you.
Okay.